Department of Health estimates put the level of HIV infections in South Africa in 2007 at more than 5.5 million. We are now at the stage of the epidemic where more and more HIV-positive people are battling illness. Drugs such as ARVs are crucial to helping people stay healthy with HIV, but drugs alone will not win this war.
HIV and AIDS is not just a health issue. Municipal service delivery can substantially reduce the impact of HIV and AIDS on our communities. Councillors need to know their constituencies and make sure that the voices of vulnerable groups are taken into account in IDP and WSDP consultation processes.
The work of home-based caregivers, like these women in Jeppes Reef in eastern Mpumalanga, highlights the importance of access to water and sanitation in coping with the impact of HIV and AIDS.
Water is life. Water is life. We really don't want our patients to have secondary infections, so they have to be cleaned. Even their wounds have to be cleaned. So you can't clean them without water.
The water supply in this part of Jeppes Reef is unreliable, in part due to illegal connections. People have resorted to storing water in open drums. This is a health risk.
We spend a lot of time going from far distances to fetch water. For 3 weeks we were not having water, and the life was not good. It was difficult for us, to do our job here. As I always said, when you do home-based care, you can't do home-based care without water and toilets.
Without an adequate supply of water and proper toilets, there is a greater risk of caregivers and other family members being in direct contact with open sores, blood, and feces. This increases the chance of the spread of disease.
In a rural area like this, there are no linen savers. Therefore, we are using these rags as linen savers. Therefore, we have to wash them. You can't do anything without water. You can't do home nursing care without the water.
Part of keeping healthy is good nutrition, especially eating fresh fruit and vegetables. Water is needed for growing food.
We are just waiting for mealies to grow and so that we can get some mealie meal. I usually say, no work, no pay. Here it's no mealies, no health, and no water, no meal.
Municipalities, we are responsible for getting the right level of service to households that are affected by HIV and AIDS. Our policies must take into account the difficulties and challenges of people living with HIV and AIDS. We need to work closely with community-based organizations that are well placed to assist us to identify and respond to households in need so that we can get services to the most vulnerable people in our communities.
You find that each and every home-based carer has got 10 to 15 patients, and those patients need to be seen in a day because most of them are bedridden. They are just lying there and they really need to be helped.
Too often, infrastructure is developed and not enough attention is given to operations and maintenance. This is not a service, it's a waste of resources. Services are what improve the quality of our people's lives, and services require ongoing delivery. The water must flow.
Oh, gosh. There is no water. You have to bath the patients, you have to wash their clothes, you have to give them water to drink their tablets, and you can't do it without water. We are facing a disaster here, really.
Good sanitation plays a central role in the struggle for health. It is a barrier to disease. The design of toilets, their distance from the home, and their maintenance are all factors that impact on caring for sick people.
For a pot to stand, it just needs to have 3 legs. And the first leg is water. The second leg is sanitation. The third leg is hygiene. So you can't separate one leg from the pot. It will just collapse. It will just fall down. Therefore, we have to mesh the 3.
We will never achieve the health benefits of safe water and sanitation without good hygiene practices. Health and hygiene education is not a luxury. It is vital to stop the spread of disease. The communication of hygiene practices is part of basic water and sanitation. We must ensure that health and hygiene education is provided as part of basic water and sanitation service provision.
Our tsunami here in South Africa is HIV and AIDS. Our councillors need to prioritize and think of the groups that are affected, like the women that are in the deep rural areas, and also our orphan and vulnerable children.
The AIDS pandemic is a reality we all have to confront within our service delivery to communities and within our municipalities themselves. As councillors, we need to set an example. We must provide political leadership by encouraging people to test and know their status. We must find the right levels of service to care for the sick and make sure that our services promote sustainable livelihoods.
Municipalities also need to ensure that water and sanitation planning, implementation and service delivery takes the needs of all vulnerable groups into account. Equally important is to ensure that people use these services hygienically for healthier, longer and more productive lives.
HIV and AIDS heightens the importance of reliable, safe and affordable water services. Our water services are literally the difference between life and death.